All right, good afternoon, everyone. Thank you for joining our Lunch and Learn today. Today I'm excited to have with us Heather Watson, and she is with our Health Information Technology program. And so she will be speaking to us about all things health and information. So we are excited for that. Just a couple reminders. We are streaming live on social media, and we will be recording this session. If you have any questions, please put those in the chat box below, and I will be happy to share those with Heather and get your questions answered. So with that, Heather, if you want to go ahead and start, we appreciate you being here.
Hey, thanks for having me. Hi, everybody. I'm happy to talk to the group today about health information technology. It's not necessarily a career that a lot of folks know about. So I love taking the opportunity to be able to teach people about our profession and the opportunities that this career affords you. Okay, so let's get started on what is health information. Like I said, it's not your typical healthcare career where people understand, oh, I'm a doctor or a nurse or a medical assistant, or I work in the lab, some of the other programs that we have here at Davidson-Davie. But what we do, we are in charge of all of the data that's related to a person's medical history. You can see that in the first bullet, including the symptoms, diagnosis, procedures, outcomes, every single piece of information that relates to the patient's history. When you go to the doctor's office, and nowadays, if you're lucky, your doctor's carrying around a laptop and they're recording your information that way. All of that information is held in a medical record. And what we do as health information professionals is we protect that information. We secure it from harm. We are responsible for the dissemination or the release of that information to other providers or your insurance company and all that kind of good stuff. So that encompasses everything, like we said, history, lab results, x-rays, any demographic or clinical information. You can take a patient's record across time and view it as a larger data set that helps researchers make public health decisions, such as COVID-19, on how to handle a population's health crisis, any kind of individual diagnosis that an individual area may be seeing, or a county or a city or even the state. We can use that data from the medical record to then create interventions to decrease the disease in that particular area. So all that data is stored in the medical record and then cataloged and provided to researchers quite easily when they need specific subsets of information. And all of this data, including the medical record, is kept in a department in most healthcare facilities. So if you're local, I want you to think about Baptist or Novant, Forsyth Medical Center. Also Cone Health over at Moses Cone or Wesley Long. All of this is held in a department called the Health Information Management Department. We used to be called Medical Records. I think sometimes people are confused about what exactly is health information. They understand what is medical records a little better. But all of that data is managed in the Medical Record or Health Information Department. Okay, so that's kind of what that is, but what do we do exactly? So great news. We're highly trained in the latest information management technology applications. So the most updated technology standards as far as the electronic health record is concerned, how that interfaces with other systems in our facility, and how we draw the information in that we need that I mentioned earlier. We like to think of ourselves, and it's the truth, that we're the link between clinicians, which is big and fancy for the healthcare providers, administrators, the technology designers in our facility, all the facility operations, and the traditional IT departments. So we work very closely with the IT department since we are health information technology. There's a specific subset that specifically works in IT, that is responsible for the upkeep of the electronic health record. Remember when I talked about your doctor carrying around the laptop and entering all your information in there. And so what we do as far as clinicians or healthcare providers are concerned, we're going to provide the most up-to-date medical record for them at the time of treatment. We're responsible for ensuring that that record is, again, held safely and securely, but also that it's updated so that when a clinician needs it, let's say for an emergency room visit, one of the most pressing times that they're going to need access to health information, that we have ensured that all of the information is up to date and ready to go for that clinician and other healthcare providers that are needing to make some fast decisions as far as healthcare is concerned. We also support facility operations primarily on the billing side of the house, and we're going to talk about that too, where we've got certain career paths that you may or may not have already heard of. They generally fall under an umbrella called revenue cycle, and those facility operations are responsible for, making sure the hospital gets paid for the bill. So that's the other side of healthcare, right? So in addition to everything that I just talked about, we also, again, are working on the classification of diseases in our facility. That's a standardized method in which we collect the data and use the data that is in a medical record. We're going to use that again for clinical, financial, and legal aspects of healthcare, which is another wonderful side to our career path is the legal side. And we'll talk about that again too. And then the last thing is, well, not really the last thing, but one of the last things that I have listed is we care for patients by caring for their data. And we, again, are responsible for the quality of that, the integrity, security, and protection. So it's our responsibility to ensure that the patients have the legal access to their health information at any time that they need it. And so you may understand as a healthcare consumer that you have access to some of your information on a patient portal. If your doctor or your facility utilizes patient portals, we also help with the connection of that information being available in that portal. Okay, let's see here. Oh. All right, so what can I do with this degree? So this particular degree has many opportunities. So again, I keep pointing back to the medical record and the physician's office and all that kind of good stuff. But I want you to expand your thinking out into all of the elements where healthcare is delivered across the delivery system. And so, your medical record, we start procuring information on you at birth and it ends in death. And so all the little visits and everything that you have in between make up your healthcare journey. And so along the way, a health information manager is going to interface with that information and help you with it. So opportunities are going to be in hospitals, doctor's offices, insurance companies, and you can expand that out to anywhere we are keeping a medical record. So somebody might say, what about my dentist office? Or what about my vet's office? We're keeping medical information on pets there. Yes, but to a lesser degree, you can take this information and apply it in multiple different types of healthcare settings. So you just change it around to make it applicable for the dentist office, for the physician's office, for the urgent care facility, etc. So the manager of the HIM department would be in any healthcare facility. You're going to have someone that is in charge of the dissemination and the protection of that information. And typically, I want you to think more about medical facilities like Wake Forest Baptist, Novant, and Cone Health. So the larger facilities, I'm going to speak about those right now. They have very robust health information departments where a lot of the different jobs that you see listed on the slide are available. And one of those is a management track that is available in this degree too. So all of these different jobs, which I'll talk about in just a minute are available, and then some. The easiest way to think about our degree is it's classified into two categories, basically. So there are two sides of the house when it comes to health information. There is a revenue cycle and HIM operations. So let's talk about revenue cycle first, because a lot of students come to our program very interested in a career in coding, or some people may think of it as medical billing. Which is a piece of coding, but we're training you to be coders. So what is that? You can see over here on this little monitor, it talks about the main condition, and it has an alphanumeric code listed out beside it. So the simplest way that I can explain that is that the medical record professional, or the HIM professional, is going to read your health information from admission to discharge. They're going to try to arrive at the same diagnosis the physician gave, just based on the information in the health record, because obviously we're not at the bedside. And through that process, we're going to come up with one of these alphanumeric codes that is applied to the patient's stay. And sometimes it can be a bunch of them. It's not just one. And then that's how the facility is going to be paid for that patient's stay. Within the kind of career ladder for revenue cycle, a lot of our graduates find themselves either in inpatient or outpatient coding. And there are multitudes of different jobs in both inpatient and outpatient, but those are the two main categories. And beyond that, there are outsourcing companies. There are opportunities in management after you get a few years under your belt. There are some clinical data educators, people that help physicians make better notes, and other healthcare providers write better notes in the medical record to better explain what they're doing for their patients, so the facility can be properly billed. We can collect the proper data, and the patient also is going to receive better care as the documentation improves. So revenue cycle is one of the hot jobs in HIM, because mostly those jobs work from home. And I think a high percentage of the people that end up in our degree are looking to become a coder. They're interested in working from home, and we are able to fulfill that. The second half of what you can do with this degree is called HIM operations, and that's pretty much everything else. So everything that I spoke about earlier, the privacy and security, the collection of the data, the dissemination of the data, the legal side of the house, all of that supports the medical record in any capacity, that falls under HIM operations. And so when you're thinking about a medical record department, you can think about a bunch of different types of sections within that department and opportunities for career paths, meaning you can enter in on the EHR analyst side and work your way up to a supervisor, or even working on the IT side of the house, helping to make decisions with software after a few years and things of that nature. Acting as a liaison in between departments, because you would fully understand the IT side as well as the HIM side, and how lab and x-ray and all the clinical documentation and all the medication administration records feed into the EHR so that they're available for our providers. The legal side of the house is all release of information and protection of the facility. We work closely with risk management, which is just big and fancy for managing the risk in the facility. We help identify when we might see some issues within the medical record that would raise a red flag within the facility that might be potential lawsuit. We respond to information requests from physicians, from attorneys, from insurance companies, from the government when they're looking to do different types of studies on our records. So lots and lots and lots of things that you could do with this particular degree right out of school, right after graduation. For some folks, they're very interested in advanced education opportunities, and we love that. So there is a bachelor's degree right now. There are some facilities or some colleges that have the degree available online, and there are some that once you have your credentials, which we'll talk about in just a second, you can kind of get on an accelerated path to that bachelor's degree. Locally, the only bachelor's degree in North Carolina right now is at East Carolina University, and they also offer a master's degree. So there's a bachelor's and a master's track if you were thinking you would like to go on. Okay. So upon graduation, you would earn this credential called RHIT, which stands for Registered Health Information Technician. And because we are a accredited program, you're eligible to sit for this certification, and that certification opens up many more doors for you. A lot of our local facilities have written the RHIT credential as a minimum job requirement into their job descriptions, and that certainly helps to elevate the position with a minimum level of education, which equals money, right? So the job requirement equals money. Your being trained, so to speak, on how to be successful on the test from your very first semester with us. We are working on concepts. That's the great thing about a technical degree. You know, you can come right in and we start hitting you with the content immediately. For the curriculum, and over the 2 years, we work towards you. Our goal is to have you graduate, but our larger goal is for you to pass the RHIT exam. And right now for 2020, even with COVID, the pass rate that is reported to us has been 100% so far. And so I know standardized testing can be a little nerve-wracking for students, and they want to shy away from that. But any healthcare career that you're considering is going to have some kind of credential, and it's worth it. That's why folks like to come to healthcare. The jobs are more stable, the salaries tend to be a little higher, and there's a reason for that, right? So we're looking for these credential folks to show the employer that you're highly trained and specialized in your particular area. And lucky for you, the last part of your semester, and if any of my current students are watching this, they just started their RHIT module the last 8 weeks of the semester before they graduate, and we're helping them prepare for the RHIT exam before they graduate. So that is another thing to, if you're thinking about this program, kind of put that on your list. And if you've got any questions about that, I'm happy to answer. Okay. So let's just get down to brass tacks. Like lots of folks want to know exactly how much money can you make. And just like anything else, it's going to vary with the position. And so remember when I said, when you're an entry-level coder, you could work in inpatient or outpatient. Well, that's what I was speaking about, So I want you to think about a visit to your doctor's office that might last 15 minutes and how that might be billed versus an inpatient visit where you might stay a few days, right? So the inpatient visit's going to be more complex. It's going to take a little longer for us to code that chart. The skill set is a little higher with an inpatient coder, so they're going to make more money starting out than an outpatient coder, right? So a little less complex, but you're able to do more because of the lower complexity, but it all shakes out at the end. Again, with the ops side of the house, you could be looking on the EHR side as a technician or a supervisor, a team lead or a supervisor. What we're finding that graduates report back to us is in coding, again, depending upon where they fall out, they're going to start between 42 and 45, and that operations is 38 to 45, again, varying positions and entry levels for those types of jobs. And then what they're reporting to us after they receive their credentials or a couple of years out, they're bumping to 50 plus. And so that's pretty good, I think, a good return on your investment for a couple of years with us. So just keep that in mind. All right, so what does a day in school look like for you? Well, we're online. So we are a 100% online program. We have one clinical that you are responsible for going face-to-face for. That occurs in your last semester. It's 48 hours. It sits in, right now, it sits in the first 8 weeks of your last spring semester with us. Otherwise, everything is available online. And so we have an asynchronous program, which means that it's available to you 24 hours a day, 7 days a week, as long as our LMS is up and working. But you're able to access that when it works for you. So let me talk about some of my full-time students who are also full-time employees, or part-time students who are full-time employees. I can look at the information in our learning management system and see that those students are working at night and on the weekends and meeting those deadlines as they occur in the program. We've got some folks that are able to be at home during the day, and we see that sometimes they're working during the day and sometimes they're working at night. Maybe they're home taking care of their children, they're a stay-at-home parent, and then at that point, once they have their spouse come home for the day, they're able to start working in the course. So there are deadlines to adhere to, but it really is available to you whenever it works for you. We've got a full-time 2-year option or a 3-year part-time option that is very nice for our working adults. And because of the part-time nature of the program, it tracks out quite nicely into HIM operations and coding. So we're able to kind of get that squared away for you in a nice tight 3 years. And so far, our RHIT exam results have been just great, even from a part-time perspective. So I don't want you to be worried about that either. Okay, Jenny, do we have any questions?
So we do not have any questions yet in the chat, but this is a great time to, you can either unmute yourself, or if you want to put it in the chat box, go ahead and do that. I know that a lot of ground was covered, so hopefully there's.
Yeah, that was a lot. So just know that, if you're looking for a career in healthcare, you want to make a difference, you're looking to make an impact, but you don't like touching those icky patients, you've found it. So your instructors are the same. We enjoy working in healthcare, love being able to help patients the way that we do, but we don't ever have to touch a patient ever to be able to do it. So I'm happy to answer any questions that you have. I'm hoping that wherever this is posted, you'll find my contact information. So if you're a little hesitant to ask questions right now, I'm happy to Zoom you, call you, email you, and answer any questions that you might have about our program.
Heather, I know you touched on it just a second ago and maybe once previously, but any other like personality or character traits that you can think that mesh well with this program?
So there is probably an aptitude for science, right? And that doesn't mean that you have to be fantastic at it or you have to love it, or you just have to know that with any kind of healthcare program, there's going to be an element of science to it. So we have, moving forward, starting in the fall, we've got a 1-semester anatomy and physiology course. We've got a disease process course, that's built in with some pharmacology, which is just big and fancy for medications and all that kind of good stuff. So a little more on the science side. There's a little bit of math, but, just understanding that, like I said earlier with coding, that you're really trying to be able to read that medical record from admission to discharge and really arrive at the same diagnosis the physician did. So there's a little understanding about disease process and anatomy and physiology that goes along with that.
Great, thank you. And we do have one other question. People who do this job, do they spend most of their time sitting down in front of a computer?
That's a great question. And the answer is yes. And so what we know is that we hear that a lot of the folks that tend to work in health information sometimes have standing desks to help them out. But yes, it's pretty sedentary, which is probably it's either a good thing or a bad thing. But that's the nature of the work. Now, some of the positions that maybe aren't from home, if you're in a traditional facility where you're wearing, or a non-traditional facility, maybe like a long-term care facility where you're wearing a lot of different hats, there's probably a little more movement. But your typical ones where you're working from home, you're definitely going to be in front of the computer a lot. That's a great question.
It's so great that they have like the stand-up desk though now and things.
Yes, definitely.
Yeah, for sure. All right, any other questions? And like I said, you are welcome to unmute and just ask Heather if you do have one. All right, well, if there are no other questions, Heather and I will stay on for the next 5 or so minutes just to see. But if not, we really appreciate you joining in. And if you have any questions, I'll go ahead and put my email address in the chat box to everyone. So if you have a question, you can email me and I can get you in contact with Heather, or you can email her directly. Either way, our emails at the college are fairly simple. It's just our first name _ last name at davidsoncccc.edu. So we appreciate you all attending today, and have a good rest